If you experience obsessions or compulsions more than 1 hour a day consistently, then ERP and Prozac may be right for you. Obsessive compulsive disorder is a psychological disorder typically derived from the combination of obsessions and compulsions. Obsessions are recurrent and persistent thoughts or impulses, commonly followed by compulsions, which are behaviors that you feel compelled to do. Common types of obsessions may include contamination, airs of uncertainty regarding daily behaviors, thoughts of physical harm or violence, and orderliness. Common compulsions may include checking, counting, hand-washing, symmetry, fears of harm to self or others, or repeating specific words. Although the obsessions and compulsions both typically occur, you do not need to be experiencing both to receive the diagnosis of OCD.
I was diagnosed with OCD when I was 18 years old. My mother smoked during her pregnancy, and I now partake in distorted thinking. I feel like if I don't act in a certain way, then negative things will happen. And when I can't control my thoughts, I am overwhelmed with anxiety. I'm constantly skeptical of someone that holds beliefs that are different from my own. But I'm not just a neat freak or a germaphobe. I am a person living with OCD, and luckily, there is hope.
Exposure and response prevention therapy, also known as ERP, is a great psychological treatment option for a person living with OCD. This therapeutic approach consists of first facing your feared situation and second, following up with no ritual. Patients can be exposed to actual situations, in vivo exposure, imagined situations, imaginal exposure, or the physical sensations associated with anxiety or discomfort, interoceptive exposure. The ultimate goal of ERP is to challenge how a patient responds to distress and to learn from that. Depending on the severity of your OCD, your ERP treatment plan could have the frequency of 1 to multiple sessions a week. Overall, about 50 to 60% of patients who complete ERP treatment show clinically significant improvement in OCD symptoms and have been able to manage them long term. If further help is needed, there is an option of medication such as Prozac, which is a selective serotonin reuptake inhibitor, also known as SSRI. SSRIs can restore balance to neurotransmitters in the brain, which can bring back balance to your life.
I found relief through utilizing exposure response prevention therapy, also known as ERP, with a licensed professional, and you can too.